Most people are treating SI joint pain incorrectly because they're thinking about it all wrong. Western medicine thinks about SI joint pain often as like inflammation in the joint, but if there's inflammation, you tend to be like stiff in the morning, better with heat, better with movement. And inflammation doesn't just happen overnight, it's a slow onset. And oftentimes, SI joint pain is kind of like an acute injury. On the other side of the equation, chiropractors tend to describe the SI joint as getting stuck in rotation or kind of jammed. But if you look at the anatomy, that's one of the most stable joints in the body. It has all sorts of ligaments, attachments, and muscle attachments. Also, the joint is supposed to move. It's not going to just rotate and get stuck out of place. How people actually come into the clinic is with usually a sudden pain. Kind of they point right at the SI joint, and it usually starts after some sort of like lifting or twisting motion. And that type of injury looks a lot more like a musculoskeletal or fascial injury than it does an inflammation or kind of a jammed joint injury. Here's what's actually going on. If you look closely at the SI joint, you're going to see a lot of muscle attachments directly onto that bony structure. It's also extremely rich in like connective tissue and proprioceptive nerves, which gives the brain feedback and helps it coordinate all those muscle contractions when you're lifting. What I see most often in SI joint is a soft tissue injury at those attachment points, either a muscle strain or a fascial tear, and that tissue then goes into spasm and creates radiating pain that goes into the piriformis or glutes, or you'll find it travels kind of up the back along the spinalis or iliocostal muscles. And that what creates the illusion that the hip is locked as those muscle spasms. The joint isn't the problem, it's the tissues controlling the joint. This is also why it's actually kind of easy to diagnose if you know what you're looking for. If you press in those areas over the sacrum and the SI joint, it will definitely be tender, specifically a little bit lower than S1, kind of like S2, S3 area. And the great thing is you also, because it's one-sided, you have a healthy side, and you can kind of just palpate and compare the two sides. And what you'll often find are very specific muscle fibers that are in spasm. If you know where to palpate and you know what you're looking for. Most SI joint pain is not a joint issue. It's not stuck. It's not inflamed. It's actually a soft tissue injury that most people kind of miss. So hopefully that'll help you.